Welcome to the SmartFlow podcast presented by Jotform, where we feature top leaders sharing their smart solutions in business and life.
Hi, Chad Franzen here, one of the hosts of the SmartFlow podcast, where we feature top leaders in healthcare. This episode is brought to you by Jotform. Jotform is a HIPAA-friendly, no-code platform that empowers healthcare organizations worldwide through custom forms, e-signatures, and more. Their solutions enhance patient and provider experiences by streamlining intakes and automating administrative tasks, all in a secure environment. A great example of this is Body Brave. They consolidated 5 separate platforms and replaced them with Jotform Enterprise. They obviously saved money, but also saved 120 hours a week of staff time in the first 6 months with Jotform's data collection and reporting tools. Popular use cases for healthcare organizations include digitizing forms, replacing paper-based processes, collecting e-signatures, and much more, so they can ultimately focus on delivering exceptional care. It's also very easy to implement. I've even used Jotform myself, so that tells you it's really simple for someone who's not technically minded. Learn more by going to jotform.com/enterprise. My guest today is Molly Reyna, Chief Strategy and Growth Officer at Tela. Molly brings over 2 decades of experience in healthcare leadership with a focus on telemedicine and the development of patient-centered, efficient care systems. She began her career in 1996 as Director of Continuing Medical Education and has held a variety of executive roles since then. At Tela Specialists, Molly oversees strategy, growth, and operational leadership for telemedicine services, particularly in Neurology and Psychiatry, supporting hospitals and healthcare systems nationwide. She holds an MBA and BA from Texas A&M University Corpus Christi and is recognized for her expertise in building and scaling telehealth programs, both domestically and internationally. Molly, it's great to talk to you today. How are you?
I'm doing well. Thank you for that kind introduction.
Yeah, great to have you. Hey, tell me, what is Neurology and Psychiatry?
Sure. So basically, Teleneurology and Telepsychiatry extend the reach of physicians. So our physicians are located throughout the U.S. The patients are also located throughout the U.S. And in that moment of need, whether it be in an emergency case in the emergency department or if it's an acute case on the patient care floor, our physicians are there, typically within 3 minutes to bedside and ready to take care of that patient at that moment that they need to take care of that patient. And they collaborate with the care team on the ground, basically becoming an extension of that care team and the clinical specialist as part of that team.
Okay, interesting. We'll get into more of that stuff as we go on here. But tell me, what initially drew you to the field of telemedicine and this kind of healthcare operation?
Yeah, great question. So when I joined, and you said 1996 in the intro, and it sort of gives me that shock every moment. So I'm going on 30 years since sort of the inception of this, desire to jump in and connect patients with providers. So immediately after completing my BA, I didn't quite know what I wanted to do. I thought at the time, I contemplated medical school and it just really wasn't in the cards for me. And so I landed in different healthcare organizations. I worked at like a medical lab for court-appointed folks that had to have tests done, outpatient PC, and then eventually just wound up landing at that residency program, running their graduate medical education and continuing medical education. And so basically for about 3 years, I audited residency education lectures. I crafted hundreds of accrediting continuing medical education programs. And it opened my eyes to sort of this greater inner workings of healthcare. And around that time, Southwestern Bell was coming around and giving these basically refrigerator-sized video conferencing units to different healthcare organizations. And so we started with a distance learning training program and then parlayed that into really clinical telemedicine. And really my launch into full leadership in healthcare was when I moved from Texas to DC, Washington, DC, and was brought on to expand the regional telemedicine program. And then eventually that parlayed into the international program. And it was really at Children's National Medical Center that I was able to hire team members, build teams, work with clinical colleagues to solve all sorts of clinical access issues. And it really expanded my experience and comfort with building these solutions and really became more of a leadership role in healthcare and healthcare solutions for patients.
What do you think maybe, or at what time, maybe when did the turning point occur where everybody kind of thought like, oh, this telemedicine thing, this is really a thing.
Yeah.
This is really realistic.
Great question. I think it depends on who you ask. I think for many years, it was a very, very small industry. You ran into the same people. We were all on the same speaker circuit. We were all saying the same things. And it grew, initially in the 90s and early 2000s, when I was doing this, I had explained what it was. Not a lot of people knew what it was. And certainly being in that DC area, being involved in Days on the Hill, being involved in, speaking, oral committee presentations, as well as written presentations to get telemedicine on the forefront, we saw a boom and a growth during that time. But I really do think that from a large and sort of accepted, sort of global acceptance came during the pandemic. And you certainly hear more people talk about it now. People are more savvy about it. And you see, lots of people either expanding the services they provide during that time via telemedicine, or companies like ours that sort of cropped up and said, hey, we got to do this thing. So I really think, I think as we got into sort of mid, teens of the 2000s, there was more of a greater acceptance. Lots of people using it for specialty care. Really grew out of rural care at that time as an acceptance. But certainly the pandemic has just been that huge sort of moment, that turning point, I think, for all of healthcare.
Yeah, I can definitely see that. So what are your primary responsibilities then as Chief Strategy and Growth Officer with Tela Specialists?
Yeah, so it's really just growing our reach. And part of that is developing new services. So one of the things I think this company does very well is, although it started with, stroke and neurology, is can we do this in a different way? Well, I'm sure we'll talk about our physicians and how they launched the program. So they, wanted to do things in a different way. They all worked at the hospital level and said, there's just got to be some other way. We're running around the hospital. We're not making our times. It's very uneven from a quality standpoint. So that was, really, really important to them. And so it's expanding those services to more and more facilities. But one of the things I get to do, which is a real luxury, I think, is be very creative. And so I'm able to listen to our customers. What are the needs? And we've been able to enhance our services and expand them within neurology, within psychiatry at the hospital level. And now we're expanding out into the outpatient space, because if you don't have doctors in the hospital, you probably don't have them post-discharge either, or from a preventative standpoint. And so I'm able to work with our teams, one, to extend services, so lead sales, business development, marketing, to make sure that people know about our great services and we can expand across the U.S. But really a central part of the role is, what can we do more of? Can we do more of the same? Can we adjust? Can we go into entirely different new verticals? What are our customers' needs? How do we help them meet their goals?
So tell me a little bit about the background of Tela Specialists then.
Yeah. So, I think it started around 2013. We actually started seeing patients in 2014. And there were a group of 6 physicians who got together and said, there is a better way to do this. So we have been physician-led from day one, and we're still owned by those same physicians and led by those physicians. They function today as managing partners. One of them is currently our CEO, Dr. Nima Malzoun, has been from day one. And they just, I think, had this vision for not just in our region, but how can we make this better for patients? And how can we make this better for providers? So I think we run this 2-prong approach of, we want to make sure we're meeting the needs of our partners and their patients, but how can we be a place for physicians to land, to practice in a way where they're just focused on the medicine and all the other things we take care of as an organization. So it really was, I think, a bold vision at the time. There were some companies that were doing this. A lot of them were private equity. Some were venture capital, as today. But this group of physicians just came together and said, we're going to do this from a physician mindset and launch this service. And now 11 years later, we've seen 1.5 million patients. We're in 40 plus states. We have 200 employed physicians, we have over 400 hospitals. So it's just an amazing story, and just, I think a testament to leading the way they've led from that physician-patient mindset keeps us successful.
So do you think that physician-owned structure then is what maybe sets you guys apart from other telemedicine providers?
Yeah, I do. I've actually worked for some other companies. I worked for academic medical centers. I've worked for commercial organizations like this one. So I can say, with my non-marketing hat and just real, this is a very different company and it's led in a very different way. And I think it's the edge that we have is that we're looking at that physician, that patient all the time and all the decisions we make. So we don't look at it and say, what should we do? What should we take to market? We say, what does the patient care need? What does the physician need or the provider need? Will that be feasible? And it seems like just a minor tweak, but really leading from that mindset really gives us, I think, an edge into what we bring to market and how we meet our customers' needs.
We mentioned teleneurology and telepsychiatry. Can you tell me maybe the range of services that telespecialist offers?
Sure. So those are our two primary service lines. Within the teleneurology vertical, hospital-based services is our predominant largest service. And that includes emergency neurology, which is inclusive of stroke and really the bread and butter of what we do, the largest portion of what we do. But within the scope of emergency neurology, there's other stat or acute situations or some even emergent situations that we need to respond quickly. Not as quickly as a stroke, but you need to get there within a certain amount of time. And so that is provided in the emergency department. It's also provided on the patient units and the ICU, wherever in that org that a patient has a need. That's a fairly immediate need. That is a big portion of what we do. We also provide teleneuro hospitalist rounding. So when a patient is admitted, either after a stroke or they just are admitted to the hospital, a physician rounds on them every day. And sometimes that includes specialty physicians. And so we're that specialty physician when they don't have one on the ground or they don't have one that can cover 24/7, 365, we may cover in a hybrid approach. Along that same vertical, we provide EEG interpretation services. And so again, you have a shortage in one area, you tend to have this, need across the board. And so we're reading both immediate need stats when they're hospital admitted patients or less acute, more routine EEGs. We also read those. And then we just recently advanced services into outpatient. And so when a patient is discharged from the hospital and the hospital says you need to follow up with your community neurologist, what we were hearing from our customers is they have some that have a 9-month waiting period. And you can imagine the scariness, for a patient, you're, discharged from the hospital, this major life event occurred and you're like, what am I supposed to do now? You're handed a bunch of pieces of paper and we've all been patients or had family members that are patients. It is a very daunting task to get all the services that you need so that you can make sure you're not having long-term effects from your stroke. And just to follow up, because if you're at higher risk, you want to make sure you're catching any risky situations early. So that was launched last year in 2024, and we're continuing to expand that. We're also getting into some outpatient care coordination, so early intervention for people who may be suspected of Alzheimer's or other types of impacting sort of long-term chronic concerns with neurology. And then in psychiatry, currently, we only offer hospital-based services. Much like our neurology service, we can see patients anywhere in the hospital. A lot of those come to us from legal paperwork. So they may have just a very emergent or acute episode where they need intervention. And so our physicians are there to provide that support. If neurology, is very needed from a specialty standpoint, psychiatry is even more so, as we know. It's a very big epidemic in our country to need medical support for mental health that we don't often have. And then, lastly, we're looking at some other service lines. So I think we'll have some other clinical service lines beyond those two that we launch in the coming years. And we're also have launched a platform called TS Route, which is sort of our engine that makes everything work and makes everything streamlined regardless of where the resources are.
Do you still, I know during COVID, telehealth was pretty much your primary option unless you were really in dire straits. Do you still get maybe concerns from people like, I need the doctor to be able to reach out and touch me?
It's very, very rare. I think most people, I think acute and emergent care, that was always less of an issue for people. They just want the care when and where they need it. They don't want to have to be in an ambulance or a plane that takes them far away from their families and their communities. So I think always we've had a little bit more of an acceptance in that emergent care because people just want to be cared for in their communities. We do from time to time get patients, particularly on the inpatient unit, who may say, why isn't my doctor in the room? We more than often get comments like, I'm so glad you were here. I got discharged from the hospital faster. It was really cool to see you on a screen. So it tends to be much more accepted. And I certainly think that just the global epidemic really probably moved that acceptance curve further down the way.
Sure. So
Yeah.
when a hospital decides to partner with telespecialists, what does that process kind of look like in terms of implementation?
Yeah, so we handle everything. And that's part of my team. We want to make it as, easy for the customer as possible. We call them partners. We want to make sure that we're meeting their needs, meeting their goals, and we do all the heavy lifting that we can. And we do that in a couple of ways. We have an implementation team that just takes the handoff from our business development team and just leads them down the path. It is a very structured implementation path. We know what needs to be done, when it needs to be done, and it is very much like clockwork for the customer. We get a lot of good feedback that we sort of hold their hands and lead them across the way. We utilize something. So we're an organization that values continuous improvement. And we use a lot of lean methodologies, Lean Six Sigma methodologies, to make sure that we're reducing as much waste as possible for ourselves and for our customers. And so central to our implementation is a lean led event called a VSM, or a value stream mapping. And so it really hones in on, what is the organization doing today? What are we doing tomorrow together? And it just sets the stage for everything that we're going to do. And so it really becomes very simplified to get them onboarded. And then post implementation, we hand off to a quality program specialist. So we have a team of nurses who have worked at the hospital level. Oftentimes they've been a stroke coordinator or led a division for a particular clinical area. And we hand off to them, and we hand off to our account management team as well. So they have a clinical person that's managing them and managing the relationship and meeting their needs. And we have an account management team that's doing the same thing for business concerns and business goals.
Do you find that changes in policy, maybe telehealth policy, are impacting your operations regularly?
At the hospital level, I think it varies. I think the one thing that we've seen and that we've talked about is, this is a precious, finite resource, right? A physician's time, a physician's specialty. Are there ways that we can introduce other providers? Can we introduce an advanced practitioner like an NP, those sorts of things from in a supportive role? And we're seeing some hesitation with that. From telemedicine as a whole, it's not an issue. Most organizations are using telemedicine in one way, shape, or form. I half the time we're coming and they don't have neurologists that we're sort of taking the place of. Sometimes we come and they're just switching over to us from another provider. Some of them, their providers in-house use it across their multiple facilities, because if you can imagine a 1 or 2 neurologist support team at a hospital, they have to use some technology. They're covering outpatient, inpatient, acute, emergent, and so they have to sort of spread themselves out. So most folks do not push back on that. I think it's when we're looking at sort of new ways and novel solutions to things that maybe they've not employed in the past.
How is the impact of telespecialist services on patient care? How is that measured?
So we have that quality team that I mentioned for every single patient encounter. And I'll just use stroke as an example. So for every stroke patient that we encounter, from the moment the consult is requested till we have placed the note in the medical record, we collect over 100 data points for that care pathway. And we look at things a little bit differently. We look at door to needle time is very important in stroke response. And what that means is, when a patient comes in and they're having a brain blockage and they need that clot removed, there's a drug that's given by IV. And so they call it door to needle time. And there are national guidelines for that. And so we look at that, we measure that, we follow that, but there's a lot that goes in that time. And there's metrics to meet it in 30 minutes, 45 minutes, and 60 minutes. And so we say, that's great. We want to look at the full time. We want to make sure that we're helping meet those guidelines or improve your response time against those guidelines. But we look at intervals of time. We call it rapid eye. We look at 4 intervals of time, because what we want to do is say, great, we did it in 40 minutes. How do we do it in 30? And so we want to look at every single one of those intervals of time. And so there's multiple data points that fall underneath one of those intervals, and everyone that is involved in that care in the moment it's happening can see those timers elapse. They can see them on their screens. The physicians can see them, so we can intervene. We're not like digging at data later. We want to see it in real time so we can make real impact and make changes should we need to make those changes and call things out. Hey, we want to make sure that drug gets mixed quickly because we're at this time right now. So it is a very active sort of review of all of those data. And then post consult, we can look at that from beginning to end and really dig in deeply. Our system that we have homegrown is called Telecare, and it is able to automatically trigger what's called a root cause analysis. So if we fall out of anything, the system is telling us, hey, look at that and look at this deeply. And we go through root cause analysis so that we can, in that moment, determine what happened in the case. And then all those cases are rolled up in a trend so we can look at trends over time, because you want to look, very detailed and small and granularly, and you want to look very large so you can make a big impact to the system as a whole.
Very nice. So, technology is always evolving. I'm sure healthcare is evolving as well. What kind of trends do you see shaping the future of telemedicine?
Yeah, I think AI is on everyone's, minds and tongues and everything else. We talk about it all the time. We've just finished a very busy sort of event season. So we've been at some association meetings. We were at Becker's Healthcare. We were at HIMSS conference, and AI is everywhere. Everyone's talking about AI. We use it today as an operational tool. We're not using it as a clinical tool, although I'll talk a little bit in a moment about how neurology is doing that. But from our company, we're using generative AI to help us make decisions to scale and to respond in the moment. So scheduling is there. We have audits to make sure our quality levels are there. There's visual AI. There's all sorts of tools and ways that we're using that. So I think, remains to be seen how much or little or how acceptable it is. I know that there's some areas of radiology that utilize it to sort of pinpoint areas and to help practitioners be able to hone in on certain areas of concern. Mm-hmm. Neurology has been doing that for a long time. There's a couple of companies that most of the hospitals that we work with use. And so we're able to utilize that as well in decision-making for imaging, for treatment. So we are using it. I think that's just something that's going to continue to evolve, and we're going to have to see how that evolves outside the operational sphere for telespecialists. But that's how we're utilizing it. And we're just continuing to use our team and to sort of delve deeply into what next. What do we think we can do with AI?
And you said it was used for teleneurology as well?
Yes. So the imaging portion is, there's two companies that we partner with. One is called Rapid, one is called Viz AI. And these have been long-standing tools. And so when an image is uploaded, it goes into the system, and it really is a tool that helps anyone that's looking at that really hone in. For the operational aspects, we use that across our company for all support. So that's for psychiatry and neurology. We're using AI to make sure that our quality is maintained and that our operational systems are tested and tracked and assessed.
Okay, sounds good. Hey, I have one more question for you, but first tell me how people can find out more about telespecialists.
Yeah, so we are on all social media, but we, of course, have a website. So tstelemed.com. You can come on and just learn a little bit more about our organization, whether you need services or whether you're a provider looking for a new role. You can hit our website and get all the information that you need.
So I'm sure most healthcare leaders have already implemented telehealth services, but maybe they haven't. What advice would you give to healthcare leaders who are looking to either implement it or expand that service?
Yeah, great question. I think keep it about the people. I think given all the technology that we talk about in healthcare and certainly in the sector of telehealth, we're focused on, all the bells and whistles, the technology. What does a cart look like? Should I do fixed units? And sometimes that gets in the way of actually what we're trying to accomplish, which is just making sure that you're getting the right physician in front of the right patient at the right time. Like that's it. You can boil everything else that we do, everything that we've done everything I've done over the last 30 years is how do we support patients and providers who are people like us, right? We all know providers, caregivers, nurses. We all have been or are likely to be a patient in the future. And so I think just keeping it about what does the physician need to know and see to take care of that patient, take care of them effectively, take care of them consistently, is what anyone that's developing a telehealth, telemedicine program should focus on, and then fill in with how you're going to do it and how you're going to power that patient care experience.
Okay, awesome. Good advice. Oh, hey, I had one more question for you. Sorry.
Sure.
I have to ask this one since this podcast is powered by Jotform, which is all about creating efficient workflows. Is there something that you found to be a big bottleneck in maybe your organization's process or workflow?
Yeah, I think given that we use those lean methodologies and we test those all of the time, I think the biggest barrier for anyone, including us, is how do you navigate that change? How do you make sure that your systems can keep up with what you're trying to do? So one, I think you have to be curious. You have to ask the question. You have to make sure that you're testing what you believe to be true and be able to adapt. And two, you need to have systems in place. And by systems, that is technology, it's people, it's process, to make sure that all of those are in alignment, and that you're making sure that you don't just impact or you don't, create a change without understanding what the impact will be to the people who are party to that change. So I think change management and just making sure that those systems are keeping up with your ideas are always the challenges for any new initiative.
Okay, sounds good. Hey, Molly, it's been great to talk to you. Thanks so much for all of your insight and for all of your time today. Really appreciate it.
Great speaking to you. Thanks for having me. Have a great day.
You too. So long, everybody.
Thanks for listening to the SmartFlow podcast. We'll see you again next time. Be sure to click subscribe to get future episodes and go to jotform.com/enterprise to learn more.